Hey, what's up? This is Corey Dion Lewis, clinical health coach and host of the Healthy Project podcast. Now, the research shows that social determinants can have a greater impact on your health more than healthcare or lifestyle choices. The purpose of this podcast is to discuss how to improve health and reduce health inequity by speaking to healthcare professionals, thought leaders, and entrepreneurs. Now, if you're enjoying the podcast, give it a review. Or you can also make a donation to the Healthy Project using the link in the description. It takes 30 seconds and it's super easy. Hey, thank you so much for listening. Now let's get started.
Thank you for tuning in to the Healthy Project My City, My Health edition. I'm Krisha and I'm excited to be your host again. For those of you that are new, I'm a senior at the University of Iowa where I major in psychology and I'm minoring in gender health and healthcare equity. I'd like to thank Corey for joining me this morning. Before we get started, would you like to tell the listeners a little bit more about yourself?
Yes. First of all, Krisha, thank you for coming back for not the first, the second, but the third time, because I don't think everybody know you help with My City, My Health, Iowa City. So thank you for doing this again. But Corey Dion Lewis, I'm a health equity advocate. I advocate in a few different ways. One, through my work as a clinical health coach at a federally qualified health center, where I help patients improve their health and understanding of their chronic disease. I do that through the Healthy Project, which is my public health media company, where I do the Healthy Project podcast that we're on today, and amongst other things that we'll probably get into during our conversation. And yeah, just excited to get to talk about the upcoming conference.
Yes, that's super exciting stuff. I wanted to ask you, what does the My City, My Health conference mean to you, and what kind of inspired you to start this?
So the conference means a lot to me, Krisha, in the sense of when we. So let me answer the second question first, and that will go into that one. So what inspired me to do the conference was the fact that um, we were getting a lot of attention with the Healthy Project podcast. So it was like, wow, there are a lot of people really fighting for health equity, really wanting to hear those conversations. And it was like, okay, what's next for the Healthy Project? And when my guy Larry, who co-organizes the conference with me, was like, hey, we need to do a conference and bring this conversation to light, because it's one thing having the conversation with people that agree with you, right? But it's one thing to bring it to people that may not know. They may be in a space where they didn't realize, wow, they have a lot to contribute to health equity. So bringing that conversation um, was important, and that's what inspired us to do the conference. And it means so much because from the beginning, just seeing just seeing the conversations that are being had behind the scenes, not even talking about the panelists, but in between panelists and people that were able to connect with each other. um, a lady came to me at the My City, My Health Iowa City conference and was like, I've been in this role in University of Iowa for years, and I never knew this person in this department, and I never thought that I should have met them years ago. Like, this is great that we're able to connect. So it means so much because not only are we having the conversations, but it's allowing people to build on relationships and to improve health equity in wherever they're at in their community and their company.
Yeah, I can definitely agree with that. I was able to attend the My City, My Health conference in Iowa City, and I was just able to connect with so many other students and so many other individuals in the field. And it was kind of nice to just hear about their work and ways that I could potentially get involved with some of their projects as well.
Yeah, and I mean, and then keep in mind, the University of Iowa is not a small school, so I mean, it's not hard to think like, wow, I wouldn't know, but it's really like you could be walking by somebody that you could be working with or really do something together and just never know it. So that was really cool to see it and see those connections being made.
Exactly. So, kind of leading into my next question, what has been your favorite part about organizing the My City, My Health conference?
Man, that's such a good question because there are so many. So one, seeing the connections. We kind of talked about that. That was a really cool kind of thing to see. But really, if I'm being honest, it's um putting putting the experts together. That's been kind of fun because the goal of the panels. So this year we have a public health panel, um, we have a prevention panel, a mental health panel, and a community panel. So the fun part is, man, who are the professionals in this community that are doing similar work but not the same work, and getting them together so we can ask questions and get multiple different answers and have a really full conversation. So that's been really exciting to and through that process I've been able to connect with people I've never been able to connect with before. So
Mhm.
trying to find people for the panels in Des Moines, yes, a lot of these people that I do know, but some of them I don't. So it was really fun just reaching out to them and saying, "Hey, I think you would provide a great perspective for this panel," and then having coffee with them or having a Zoom meeting or just a conversation on the phone, and just being like, "Yo, I think you can talk about something that these other panelists can't talk about." And give the attendees, something else to think about. So that's been really fun.
Yeah, for sure. There's so many different people coming to the conference that you're able to get like a lot of different perspectives.
Yeah, yeah, and I love that because what I love about it is that you could ask one question and get 3 or 4 different answers. So, like, that's just fun to me to see and also to learn from. 'Cause, I don't know everything, so also even to learn from these people has been that's been a blessing.
Yeah, for sure. So kind of so we have the next conference coming up in about a month and a half. What can
Mm.
attendees expect at this upcoming conference?
So there's one. It's the same vibe that we've had last year, that we had in Iowa City. Just expect an inclusive energy, right? Just that energy of inclusiveness and belonging and just in fun, but also you're going to learn something, right? And have a really great hear great conversations and maybe have great conversations yourself. Um, so that's one thing to expect. Also, during the wellness hour, so we have half hour break, half hour lunch. So that wellness hour, I will be premiering the first episode of my mental health show, Coffee Can't Fix Everything, so people can get ready for that. So I was able to record that at the Slow Down Coffee Shop here in Des Moines. Shout outs to them. Love that coffee shop. And pretty much it's just we're talking about mental health over a cup of coffee, and the whole premise is to let people see what a conversation looks like, when we're talking about mental health, and it's just another way of destigmatizing the conversation. Like, hey, we're just having a conversation about you know, saying I love you to another man, or what these conversations are so great, and we're having them over a cup of coffee or tea, depending on the guest. And it's just that was a fun project. So people will be able to check that first episode out in November 17th during that break. But also, um, we pride ourselves, Larry and I, on how different we can make this conference. It's not your usual conference, right? So we pride ourselves on that. So this year we're grateful to have you actually in person in Des Moines. So we'll have you doing just doing some work around, in between, and just answering questions and really just capturing the moment, so people can feel that. So uh, definitely be there. It's hard to explain. You just have to be there.
I can't wait to be there, and congrats on the premiere. That's so super exciting stuff.
Oh, thank you. It was a just a idea that I had, wanting to have the thing with the Healthy Project, Krisha, is that um it's so specific in a way that's like, man, I want to have different conversations, but some of the conversations that I want to have don't necessarily fit with the Healthy Project podcast. And I was like, so what else can I do? And sitting at the slowdown, having coffee, just had a meeting or something, and the idea came to my head, and I spoke to Drew, the owner, and was like, "Hey, can I film this conversation here?" And he was like, "Sure." So it was. I got some other things in the works too, but it's just a way of, yes, mental health is a part of is a health equity conversation, but I wanted to have it in a different way. So it felt better to just create a whole different show for it.
That's really awesome. So
Mhm.
it seems like you've been making some expansions in other aspects. I was wondering, how are you looking to expand the My City, My Health conference in the future?
Yeah. So the mission for My City, My Health, since we started, has always been to have a health equity conversation in every major city in the country. So that has been our mission, and we're not forcing it. You know what I mean? I'm not trying to hit down every city and say, "Hey, bring us there." I want it to be natural and organic, and so that's um, that's been working out for us. So, we're doing Des Moines again, and we plan to do Des Moines every year if we can. Iowa City every year if we can. Those two, being a Hawkeye alum, I feel like I can bring. That's how I give back, to that community. But we have My City, My Health, Minneapolis in September, and then we plan on hitting at some point Kansas City and Omaha, and then wherever the cars lay from there. And I think it's important um, to have this conversation again in every major city in the country, in every city in the country. It doesn't have to be major city, but I feel like every city's so different, and the people who are leading the charge in health equity or public health, those community leaders, um, they need a voice, and they need to be able to speak to their community, instead of having somebody outside of their community speak for them. You know, speak to the community in a way that um, they've experienced what's going on there, and they can give a better insight. So that's the future for My City, My Health. And hopefully, we can hit that overall goal of hitting every city in the country. That'd be dope at some point. But again, we're not forcing it. You know what I mean? We don't have a deadline. Um, but that would be cool if we can do that for sure.
Yeah, that's awesome. You guys are already looking at expanding to Omaha and Kansas City. That's awesome.
Yeah, I mean, and again, it's been just natural. It's been natural. Just you know, being in the space, I've been able to connect with some really dope people doing really dope things. So being able to call somebody in Minneapolis, and they say, "Hey, let's let's do something in your town," and then being like, "Yes, like we got to let's do it," or getting text messages myself saying, "Hey, let's bring one here," and so that's been really really fun, and not only fun, but in a way like it gives me a sense of like optimism. Like, hey, there are people that are not only excited about having the conversation and having a conference. I mean, not everybody's super super excited about going to a conference, but excited about the work that they're doing, that um they want to have the conversation and let people know and share ideas. That's what's really important. Is I'm excited to hear what they're doing in Minneapolis that I can bring back to Des Moines. I'm excited to see here, when we have My City, My Health, Iowa City again, you know, what are we doing this year? You know what I mean? So is there something I can bring back to Des Moines? Or is there something that I can share with them? You know what I mean? So, in a way, it's we're building this big community of health equity, leaders and advocates to change the world.
I really liked what you said about how we're able to learn from each other. If
Mhm.
someone's doing something, why not try to implement it here as well?
Absolutely. What I've learned is, I've only been in I view my experience in health equity like a comedian views their experience doing stand up. And I was watching this comedian say, you know, if you've done stand up for 2 years, you're 2 years old. You're still a baby. You don't have a lot of experience. And I've really been pushing this health equity work for 4 years now. So I'm still young, when it comes to understanding health equity, what we can do to improve, what resources are out there, what are people doing. So I'm still learning. So being able to go to different cities and different communities and learn from these experts that have been doing it for a lot longer than I have, and even those who haven't been doing it for longer than me, but a fresh, perspective. That's important, and that's exciting to me.
Yeah, exactly. You're only 4 years old, Corey.
Yeah, I know. Yeah, so my kids can't say I'm old anymore. I'm a baby.
I know you mentioned this in the beginning about how you're the founder of the Healthy Project. For those who are new, that is a public media company that speaks with healthcare professionals and thought leaders all over the world. What has been the most rewarding part of this experience?
The the most rewarding kind of goes to my previous thought is I've had some of the top leaders in the world when it comes to public health and health equity on my podcast, and just learning from them. You know what I mean? That's been the best gift for me, is having this podcast, is being able to ask questions to thought leaders and people who have been doing this work for decades upon decades, and ask them sometimes dumb questions. You know what I mean? And get answers that, wow, I wouldn't even thought of it that way. Or so that's been fun. That's been good for me, because as my goal with the podcast is to um educate those that are listening. I'm also getting educated myself. And there have been topics that I had no education on, or wasn't even thinking about. For example, um, black maternal rates in America. I wasn't even thinking about that. And then, but having to do research after having my girl Jasmine Brooks on, who's a black doula, doing research on that and understanding, wow, there's a lot here. This is crazy, right? And understanding that, and many other topics. You know what I mean? How the Native American community or indigenous health, and how the disparities there. Uh, it's really opened my eyes to so many things that I wasn't even considering, because my world for so long has been prevention, and making people understand, how you improve your diabetes, how you improve your blood pressure, and the disparities that come with that. So, like, my world has always been, okay, I have a patient that isn't working or uses food assistance and has to supplement with food pantries. Okay, how do I help that community? And that's been my health equity work for a long time. And then during doing this podcast, I get other pieces of it that, like, oh, I don't really work with that, but that is something I need to be mindful of and thinking about. So it's just been a long a lot of learning for me. So that's been awesome.
Yeah, health equity isn't something that we'll ever have completely down. We're constantly learning
Mhm.
every single day about how we can improve.
Absolutely. And keeping an open mind to improve. One thing that I will say for me is like, again, I was stuck in this bubble of, for me, this is what health equity is, right? And my definition of health equity is this issue. And what I'm learning now, in this part of my career in podcasting and learning in health equity, is my one piece is connected to the other pieces as well. And how I make those connections, you know what I mean, it really will help how I can and improve the health of everybody that I see as a patient, and how I can improve the community, and also how I can improve my city, my health. Because there was a time where, I'll tell you this. This is a true story. The first My City, My Health, conference, we didn't have a mental health panel. It wasn't even on my radar. And so Larry was like, "Hey, we should probably have a mental health panel. This is a huge topic, and we had these connections there." And I was like, "Oh my gosh!" And when he brought, I'm like, "Duh!" Like, yeah, but it wasn't. Again, it wasn't in my. I wasn't thinking about mental health as a panel discussion, and it turned out to be one the most popular discussion we had at My City, My Health Des Moines. um, and it was a great conversation, and it was so great I felt stupid, but not even thinking about having this in the first place. You know what I mean? Because I was like, prevention for sure, because I'm a prevention guy, but like I wasn't even thinking about mental health. So understanding, having different people on the podcast who work on different parts of public health, not only help me understand, but also give me ideas for different conversations that we can have, um, in the My City, My Health universe.
Yeah, everyone has different experiences and are able to bring something new to the table, which is what's great about being a part of this team.
Absolutely, absolutely. And yeah, you said it best. Everybody has different experiences for sure. Yeah, I couldn't say it any better.
I know we've discussed a lot of things today, but what is the most important thing that you want our listeners to take away from our conversation?
You know what? For the most important thing, um, and I said it at, I've said it at every My City conversation we've had so far, is if you're listening to this podcast and you're thinking about going to the conference in November 17th, um, I want you to be thinking about how you can improve your community, your organization, or your home. What's one idea you can take away? And that is it. you know as a health coach, we talk about SMART goals, specific, measurable, attainable, the whole thing, SMART goals. And what's one thing you can take away? So as you're listening to this and you're thinking about going to the conference, be thinking about what panel you're excited about. Um oh, I do want to say this before I get into that. If you do go to the conference and you've signed up already, you will get a link, a private link, to ask a professional. It's a link where you can ask your own question to the panelists. So um, it's something new we're doing this year that I'm super excited about. And the reason why we're doing it, Krisha, is so in Des Moines, the first year in Des Moines, we left 45 minutes for panel discussion, 15 minutes for Q&A, right? And we're thinking, oh, we probably won't even need 15 minutes. We're probably not going to get a lot of questions. We had a lot of questions. Like some of the Q&A after the panel was just as good as the panel. It was long, and we're like, we're on a time. We gotta cut this short, but everybody was so engaged. So we created this link where you can ask a question beforehand, and then we can ask it during that Q&A, or we can even ask it during the panel discussion added to the moderator's questions. So that's an opportunity to get, maybe some thoughts or questions you have beforehand, and see what the panelists have to say about it.
I think that's a great idea because I was moderating one of the panels at the Iowa City conference, and there were so many great questions that I knew we
Yeah,
were running out of time, but I didn't want to cut anyone off because we were
I know,
having conversations.
I know it, because everybody on all the panelists, they're they're experts, right? And they have a lot to say. And I think what my city does is we make people feel comfortable to kind of breathe and not have to be that professional for a little bit, right? They're still going to answer in a professional way, but they can be a little bit more raw, a little bit more honest, so that leads to more of a discussion, more of a conversation. And and again, we had the same issue the first my city conference, where we'd have somebody just going off, but everything they're saying is so good you don't want to stop them, but at the same time you're like, yo, we got to wrap it up. Like, we gotta go. And then and then if somebody else would ask one more question, but it'd be such a good question, and it was just this back and forth. So we're trying to figure out how we can make that a little smoother this year. So that's why we have the link, where you can ask a question. And matter of fact, I'll send it to you after this, so you can just kind of see it and kind of see what it looks like. um and yeah, so that's one other fun little twist we're adding this year.
Yeah, I'm excited to check the link out. I think it's a great idea and will definitely help out.
Absolutely.
So, for those who are listening to our conversation today that would like to connect with you, where can they find you, Corey?
Yes, so you can find me everywhere. So LinkedIn, Corey Dion Lewis, um, TikTok, Instagram, Facebook, same, Corey Dion Lewis. Uh, Website, healthyprojectpodcast.com. And you can also go to mycity.health to get your tickets and to see the agenda for this year's conference, along with who the speakers are, presented by Unity Point Health. So shout out to them for being the presenting sponsor this year. And I look forward to just seeing everybody there. I'm super excited, from our exhibitors to our sponsors to our speakers to you. Thank everybody who's a part of this experience. Thank you so much.
Well, I just wanted to thank you so much for joining me this morning. And for our listeners to hear more from Corey, make sure you sign up for the My City, My Health conference, which is happening on November 17th from 9 a.m. to 4 p.m. And like Corey mentioned, you can get tickets and view the agenda online at mycity.health.
Awesome. Thank you, Krisha. I appreciate you.
Of course.